This is Newcap News with Kelsey Bloxam.
Good evening. Conditions are ripe across the prairies for West Nile virus. The first human case was reported just over 2 weeks ago in southern Saskatchewan, and now Alberta Health Services is confirming another human case of the virus found in that province. This is the first case since 2010 for Alberta. A woman south of Calgary has developed non-neurological symptoms of West Nile. An official from Health Services credits the weather for the increase in mosquito population.
We've had a very warm summer this year, which is why increased risk over last year. We didn't have any cases last year. This is the first case this year. So pinpointing a particular town probably is giving the wrong message that there's only certain populations at risk.
Those symptoms include fever, chills, headaches, and rash, while neurological symptoms include the form of tremors, confusion, and paralysis, and can be deadly if not treated right away.
When you have the non-neurological syndrome variety, it's just bed rest and eating well and staying at home until you're feeling better. If you get the neurological version, you're very sick.
This follows a report released earlier this month of a Saskatchewan man that was found with the disease. Residents have been advised to wear mosquito repellent when outdoors, along with long-sleeved, light-colored shirts and pants when working outdoors. Surgical wait times have dropped in Saskatchewan over the past year. The Health Ministry of Saskatchewan reduced their surgery wait list by 2,200 patients this quarter, a successful beginning to a new initiative introduced in April of 2010.
Adding additional operating capacity, doing more surgeries, operating more surgical theaters in hospitals right across the province.
The number of patients waiting 12 or more months has dropped significantly.
Last year our focus was getting down below all patients, surgeries completed within 12 months, and this year our target is to have all surgeries completed or an offer of surgery to all patients within 6 months.
The Lloydminster Health Region is included. Improvement, safety, and better surgery management are part of the ongoing initiative. Managing any kind of business is stressful, but when it comes to a fast food chain, it becomes that much more hectic. So every year, McDonald's recognizes some of the outstanding managers across the country within the franchise. And as Clayton Brown explains, the St. Paul man has been picked as one of this year's select few recipients.
For nearly 30 years, John Richer has donned the iconic big arches for McDonald's and represented the company to the best of his ability. He's worked hard to move up the ranks, and now he's being recognized.
I guess I started it like anyone would at first, to get a job. And when I got there, I basically fell in love with it. You know, McDonald's always quotes that I'm loving it, and that's pretty much what it became. It became a second family for me.
This is actually the third time Richer has received the Outstanding Manager Award, and he says he's just as proud of this one as the others.
It's an honor. It's also, I'd say, a reflection not just on me, but on the staff, the other managers I work with, the owners, James and Tamara.
Richer hadn't planned to stick with McDonald's. He actually went to university to become an accountant, but then couldn't imagine not working with the franchise.
I finished my business degree, but stayed with McDonald's because I enjoyed doing it. So, you know, some people say McDonald's, but for me it was like here was a chance to put my strengths into play.
In St. Paul, Clayton Brown, Newcap News.